Thank you, Dan. Joining us now is our medical expert, Dr. Cedrek McFadden. And we're addressing today how COVID-19 has changed hospital stays and doctor visits. So one of the things that's changed, of course, is the telehealth piece.
Yes.
So what kind of visits can we do via telehealth?
Well, almost any. Some doctors are diagnosing anything from appendicitis to strep throat just by using the telephone. And telehealth, obviously, that's not anything that's new. That technology has been around for decades, even before we had tablets and smartphones. But it's used primarily in the past in urban areas or rural areas where there were doctor shortage gaps. But we're seeing folks from, cardiologists to dermatologists to pediatricians, even psychiatrists and surgeons treating patients remotely. And just because the goal is to keep you out of the office, if you have a condition or something that's serious or worsening, you may still be asked to come into the office or go to an urgent care or ER facility.
Yeah, like when you need to do certain kind of tests, you can't obviously do that through a screen.
Correct.
All right, let's talk about when you can safely go to the hospital or the doctor. Like when is that a good choice?
Big question for everybody. And most hospitals are safe to assume that you can, go back into right now. They're making recommendations right now for how we take care of patients, from how we isolate you to how well we treat your family members when you come in. So most hospitals right now are making those recommendations. Hospitals in the U.S. are safe to, go back into. And
what changes can we anticipate when we do go to the doctor or the hospital?
So you may see those changes even before you go into the building, because you may be asked to wait in your car until your appointment time is actually settled and you can go right into the exam room. You may see less magazines in the waiting room. You may see no toys in the pediatrician's office because, again, we're sterilizing those spaces, we're keeping them safe and protecting you while you're there. If you're in the hospital, you may have limited or no visitors allowed, and that's, for some people, that can be quite prohibitive to having any procedures done because we want our family members around. But we're taking those steps to keep you safe and to keep your family members safe while you're there.
Some people have asked this question. We've gotten this in our question segment that we do live at 5 before. But if you are in the hospital and you really have to be there and you require a blood transfusion, can you in any way contract COVID-19 from a blood transfusion?
So COVID is not transmitted through blood transfusion, so blood transfusions are safe to assume that you can have. When you donate blood, there are questions asked for the donors. What's your history? Have you had any symptoms? We get healthy people to donate blood, and that blood is very well regulated and tested. We also want to use this as a plug to have healthy volunteers continue to donate blood so that we can have adequate amount for patients when we need it.
And how concerned are you and other doctors in the medical community that people, out of fear of catching COVID, don't go to the doctor when they need to right now?
So that is the concern. I mean, across the country, we've seen decreased number of doctor visits as well as visits to urgent care and ER docs. The challenge with that is we can have people sitting at home when they need to be seen by the doctor, trying to self-care. It makes sense. People don't want to go where they think sick people are, especially with COVID-19. We don't want you sitting at home, and so it's very important that you still call your doctor first and don't stay away even if you think there's something going on with you.
And if you have urgent symptoms, which would be things like
trouble breathing, chest pain, you're noticing a discoloration when you're trying to breathe from your lips or from your skin, those are things that you need to call. Even if you're confused or passing out, those are things that you do not need to be treating at home.
So definitely don't hesitate to call the doctor.
Correct.
Or even 911 if it's an emergency situation.
Yeah, because again, the EMS is still working, doctors are still working, and there may be some things that we can talk by telephone or talk by video visits. And so those appointments are still regular visits. You'll still get an appointment time for those regular visits, but we still need to make that contact with you.
We appreciate it. Dr. Cedrek McFadden will be joining us live at 5 to tackle your questions. There's a fresh post. Just put it on Facebook in the last commercial break so you can add your questions to the list, and we will tackle those live at 5. We'll see you then. You're watching Carolina's Family at 4. We're coming right back.